honored to be part of this chest conference and delighted to present my research work here at this conference. This is actually the essential requirement of my diploma in health research and biostatistics from Shaheed Zulfiqar Ali Bhutto Medical University. So this is a small randomized control trial. I'll be going through briefly through my research work. So this is actually a comparative efficacy of the beraprost and sildenafil in patients with pulmonary hypertension and those in those who are receiving sildenafil alone. So this is a comparative study basically. So why did we selected the beraprost in addition to the sildenafil as a comparator group to sildenafil alone? So there are multiple reasons behind that. Beraprost is having unique characteristics. It's an antiplatelet, it's a vasodilator, it is activator of the adenylate cyclase, which increases the cyclic AMP. It is orally available among the other prostanoids, which are injectably or inhalational. And it is also decreasing the influx of calcium into the cells. Apart from that, sildenafil also reduces inflammation. So taking into account a number of characteristics of sildenafil in combination with beraprost, in combination with sildenafil, it may have some hemodynamic good improvements and effects on the pulmonary vasculars. So the question which just came to the mind is whether the combination of this beraprost to the sildenafil will really affect the patient management of pulmonary hypertension or not. So this study was approved by the Ethical Review Board of Shaheed Zulfiqar Ali Bhutto Medical University, Islamabad. The total duration in real sense was not 3 months, it was 7 months because the patient was sequentially recruited in this study, and individual patients have a duration of 3 months, but the total study took almost 7 months for compilation as well. So which patients were included in this study? So the first requirement for that was actually the pulmonary hypertension, which is more than 40 mmHg on transthoracic echocardiography by an expert cardiologist with an age range of 15 to 70. So this was the inclusion criteria. So which patients were excluded from this study? Those patients who were unable to undergo echocardiography because of any reason, just like in patients with COPD with advanced emphysema, in which the echocardiographic window is very difficult to obtain. Those patients with cardiovascular decompensation, the same with respiratory decompensation, patients who were having allergic reactions to any of the drug, either the sildenafil or the beraprost, and those with advanced liver disease, hemorrhagic diathesis, upper and lower GI bleeding, and hemorrhagic stroke in the past. So what were the intervention basically? There were two groups. One group received sildenafil 20 milligram thrice a day plus beraprost in 20 microgram thrice a day for a duration of 3 months. And the other group, which is the control group, which received 20 milligram of sildenafil for the same duration, which was the control group. So what parameters were basically taken into account to measure the effect of sildenafil in addition to the beraprost and the sildenafil alone group? So there were primary parameters as well as the secondary parameters. Among the primary parameters, the pulmonary hypertension, the pro-BNP level, and the exercise capacity in the form of incremental shuttle walk test was measured. And among the secondary parameters, SpO2, right heart dimensions, adverse effects, hospitalization, and death due to any cause. Similarly, left ventricular ejection fraction was also taken as a secondary parameter because the patient also used to undergo echocardiography. So this is the group 1, which is actually the group with combination drugs, sildenafil and beraprost. If you look at the diseases which are involved in this, the patients with pulmonary hypertension, the highest contribution is from the ischemic heart disease, followed by COPD, CTDs, and down the list is the interstitial lung diseases. This is the combination group. This is the group which is just receiving the sildenafil alone. Again, we can see the highest contribution of the ischemic heart disease, followed by interstitial lung diseases, followed by COPD, and down the CTDs. This is actually the statistical analysis of the data of the primary parameters, including the pro-BNP, pulmonary artery pressure, and incremental shuttle walk test. So it's very difficult, but we can say that the independent sample man-Whitney test here was applied. The question may arise that these patients were underwent the man-Whitney test, why not the sample T test? So this is the value for the shuttle walk test at the start of the treatment. The BNP at the end of the treatment, this is basically the difference. This is the shuttle walk test at the end of the treatment. And this is comparison of the pulmonary artery pressure at the end of the treatment. So we can summarize here the group characteristics. We can see that the age group is a bit different in two groups. The group 1 is the combination group, and the group 2 is actually the control group. So there is some difference of age in the two groups. Similarly, if you look at the pulmonary artery pressure at the baseline, it is elevated in group 1 as compared to group 2. And if you look here at the pulmonary artery pressure at the 3 level has fallen significantly as compared to the group 2. Similarly, ejection fraction almost remains similar in both groups. Right heart dimensions were greatly improved in group 1, as we can see here. It is 42 and it is 35. Similarly, there is a marked improvement in the BNP level. We can see there is a marked reduction in the BNP in the group 1 as compared to group 2. There is almost increase in the group 2. So the SpO2 was also much improved in the combination group, and so is true for the shuttle walk test. So this is actually the summary of the different parameters, the pressure difference, the ejection fraction difference, the improvement in right heart dimensions, the fall in BNP, the group 1 and group 2, and improvement in saturation, as well as improvement in shuttle walk test. So this is the result summary of the study which was carried out. So if we look at the statistical values, we can see that there is marked improvement in the pulmonary artery pressure, the BNP, and the shuttle walk test in the combination group as compared to the isolated group receiving the sildenafil level. So this is to some extent the conclusion of the study. There are certain limitations to this study. The sample size is very small. It is almost 41 in each group with a follow-up rate of 5, so 38 and 39. The short duration of 3 months is not sufficient to conclude the study, as this can be applied to other individuals. And the lack of standardization of right heart pulmonary artery pressure, and diversity in diseases. Thank you very much.
So thank you, Dr. Israr Ahmed. Next speaker